Thank you, sir. Mr. Chairperson, sir, Professor Bhandari, Professor Anand Kumar, Professor Elawat, a lot of friends there. I think I know a lot of people here, Vinay, whom I've grown up with. It's a great honor to be here, and thank you, sir, for your kind words. I've been here in Jodhpur since 2012, once the new All India Institute of Medical Sciences, Jodhpur, was created. Before that, I was working at Lucknow, and I was enjoying doing my surgery and never thought of moving out of Lucknow. But it was a challenge, and it was something new which I'd never done in my life. So I just took it as one more interesting, different sort of a surgery which you have to learn, and then moved to Jodhpur. And I'm not a robotic surgeon. I wish I was, but maybe in the future, definitely, we're going to learn it. Definitely, that's good. So I'll be just touching about the changing scenario of the tertiary healthcare that we have in our country. And there's a lot of things happening, and a lot has happened also. So we have a rich history of medicine. We all know about that is our healthcare system, the oldest in the world. And Sushruta and Charka, all of us are so familiar. And they've been pioneers in medicine, Sushruta as a surgeon and Charka as a physician. It's been a remarkable irony that we have squandered our legacy of being innovators. And now we are considered as a developing country, and healthcare is also in the phase of development, and it's not considered to be really cutting edge. So we have a very traditional three-tier system, which is sub-centers, which you talk of at the bottom of the pyramids. Now the government is calling them as the health and the wellness centers. Then you have the primary health centers, which are the first contact point for the village, and the medical officer is there. Then you have the community health center, which is upgraded once. They are called as the first referral units. So this sounds like good old community medicine, and I always thought as a surgeon, well, it was good old community medicine, but then it has a place. So most of our healthcare system has been focusing on primary and secondary healthcare, with little emphasis on the tertiary healthcare. Everything is about preventable diseases, going to the sub-centers and PHCs. Well, it has a place, but then we have to also think a little bit beyond that. If you look at the healthcare system, if you have the private organizations which have developed so well in the last 3 decades, and there's been a big boom in the private sector where you've got good super specialty hospitals, multi-specialty hospitals. And the public health care, a lot of emphasis has been on the rural side of it, and in the urban tertiary hospitals have been there. And then you have got the medical colleges which have been there for quite some time. But then they do all revolve around government funding and how they work and what autonomy you give them to work. The tertiary healthcare in the past, if you look at it from the central government, what they created was, the state created a lot of medical colleges, but the central government created the AIIMS, the PGIs, the JIPMERs, the NIMANS, which were there. But then there's been a lot of lull after that. There was a Bhore Committee in 1946, which was under the chairmanship of Sir Bhore, and he said that he recommended that integration of promotive, preventive, and curative services for comprehensive health care they should be there. And services should be as close to the people as possible, as Dr. Trin would talk about it in his talk. Cooperation between health personnel and people should be there, and representatives of medical and auxiliary professions to influence health policy of the country. So most of the stress of this report was on the primary healthcare, and this is the report on which most of our healthcare system in our country has developed and evolved. They also did recommend tertiary healthcare, and the All India Institute of Medical Sciences, Delhi, which was created in 1956, was also as a fallout of this report, and then the PGI Chandigarh, which came later on. But after that, there's not been much. If you look at the doctor patient or the public ratio, it's 0.62 to 1,000. And the WHO say that's 1, but if you include the alternative systems of medicine, there's a lot of debate about the people from the alternative system of medicine coming into the mainstream. It comes to 1 per 1,000. So it's also time that to rethink about and to think about the tertiary level healthcare as in the public sector. The private sector has done very well. It's boomed. It's all over the country. The hospitals are there, and it's got what is called big time corporate hospitals. But the public sector boom or the public sector development had been lacking for quite some time. So it was a shift towards the tertiary healthcare. The per capita, if you look at it, the GDP, we spend much less than the rest of the world. It's 1.02. And our per capita expenditure has increased. It's nearly doubled from 2009 and 10. But yes, more needs to be done. We are making some good progress, but more needs to be done. And our healthcare system is a system which is in transition. That's what we feel. And it's one of the largest sectors in terms of revenue and investment, if you look at in the public sector from the government point of view, and even in the private. And it's cost competitive if you compare it to the other peers in Asia and Western countries. And the cost of surgery compared to the US and Europe is 1/10 or much less than what we have there. And if you look at quality care in the public sector hospitals, that's something which is the thrust which should be there. There are a lot of regional imbalances in our country. If you look at a north-south divide in the healthcare, and even in north, if you look at the healthcare, there would be centers that the urban cities or big cities would be having better healthcare facilities than the tier 2 cities, or if you go out of Delhi or other places. So keeping that in mind, the government initiated a project where they said they would, looking at the regional imbalances, they would create new institutions which would be autonomous, would have the freedom to work at teaching, research, and patient care, and also invested in upgrading in the medical colleges across the country, where they would give over around 125 crore rupees, and around 70-80 crores would come from the state government, and they've picked around 120 medical colleges across the country. 6 or 7 they've picked in Rajasthan, and we've also been involved in upgrading of those medical institutions. So if to improve this in the tertiary healthcare in the public sector, it was one of us was the setting up of the new AIIMS and then the upgradation of the medical colleges, so that you have state-of-the-art health facilities like you have in state-run facilities like Sanjay Gandhi PGI or KGMU or a few of the other institutions which are there. If you look at at Rajasthan and at Jodhpur, the All India Institute of Medical Sciences was, well, you can call it as the first was AIIMS in the PGI, then we can say that this was the 2G. That is the second round of institutions, which the 6th places that they picked up, and Jodhpur was one of them. And Jodhpur practically is like the geographic center of Rajasthan. It's in western Rajasthan, but the geographic center, all distances are almost 300 odd kilometers. At 350 or 370 kilometers, you'll have the border. And the healthcare has been an issue in this part with the medical college serving the public almost for more than 50 years. But if you look at Jaipur, the way Jaipur developed in the healthcare compared to what other parts of Rajasthan or Jodhpur, there has been a major difference between the two. Jaipur has marched much ahead. So keeping that in mind, if you look at Jodhpur is the second largest city, and they thought of having an All India Institute of Medical Sciences. There's been a lot of criticism that why we should have them, should we not have them, but yes, once it was created, so we were entrusted the thing to develop it, and there's been major imbalance in the healthcare at this part, because another 100 kilometers you go into the desert, and in Jodhpur, most of the patients or everything for treatment, either they were moving to Jaipur, Ahmedabad, or other places. And distances, even there, if you look at it, we cater to around a 350-kilometer radius around, that is the drainage area for most of our patients. And so we, at the AIIMS, when we started, the mandate for any of these institutions is about teaching, research, and patient care. So what we have done since 2012, when we started with the undergraduate program, but now we run a very well-defined undergraduate program, and it was a competency-based teaching and training at the undergraduate level from day one. The Medical Council incorporated it recently, but from 2012, we have been following competency-based, integrated, all problem-based learning from day one. That is what we have been sticking to. The postgraduate program of ours came later, and now we've got, I think, MD or an MS degree in all these specialties that we have in medicine, whether it's pre-para or in the clinical departments. Then the super specialty, we have got super specialty program running at a DMN and MCH in almost all the super specialty branches. We also started a nursing school, keeping in mind that quality nursing is an issue. So with the BSc program in nursing, which is there, and a postgraduate program in nursing, and also a PhD program for nursing, as well as in the, for the basic sciences or people want to do. So that was what we started with teaching, and I think we've been able to impart good quality teaching, which will translate into more doctors, which would be serving the society. Research is another area of focus, and we are looking into research into the regional issues. We are also joined hands with the different institutions which are here. We have, Jodhpur is lucky to have an IIT, a National Law University. We have got the defense labs, the ISRO, and so we have joined hands with IIT, the defense labs, NLU, and what is we've created is a medical innovation center, which will be lodged at AIIMS, and the engineers and the doctors would be there, and the industry would also be joining hands with that, and we'll try to run it independent of the institution without having all those administrative tangles that it should not get caught into. And in research, we always encourage collaborative work, and extramural funding is something which we are looking for, and as of now, the institution, if you look at it, we've almost around 4.5 crore plus of extramural funding from different sources, including international funding. Patient care is there. Everybody looks at patient care, and especially the politicians always look at it as patient care, and the research and teaching is something what we look at, and patient care is linked to that. So we see nearly over 2 lakh patients every year in the OPD, and last year it was around 4.5 lakh patients that we see. Approximately around 3,000 patients, 2,500 to 3,000 we see every day in our outpatient department. So once we started our OPD services, we had a queue for the people to come in, which was going from our OPD block to outside the institution gates, people queuing up to get themselves registered and to show in the OPD. This was in 2013, July, when we were just starting a basic. So this is just an idea to an impression that you'll get from this is that healthcare was an issue in this part, and people were looking for quality healthcare services. And we were so overwhelmed by this response that we said whatever we do, we'll try to keep up the standards higher that we have been set by the institutions which like AIIMS and PGI Chandigarh and other institutions of excellence across the country. So this is how, when we started, this was at the day one, that is how it's been, and it's been an upward journey always since then. If you look at patient care, we have cashless facility. We run a completely paperless hospital where we don't even give investigations to the patient. You link up and take a printout, and all the CT, MR, everything gets within the HIS system to the doctor, and all the doctors, as well as the system for registration for the patients. You can register from home. You need not come to the hospital and stand in the queue to register. And as we have said, we've got all the specialties and the super specialties which are running. This system that if we have a hospital, the HIS system, you can even link up with different things, and you can look into studying disease epidemiology about cluster of diseases which you have, where you're getting your patient referrals from, what sort of patients you're getting. So we can use it for so many different ways and involve different agencies if we see something different happening. We also run subspecialty OPDs like for lifestyles, for medicine physiology, then for genetic counseling and interstitial lung disease, depending on the expertise available. And telemedicine we use for our with National Academy of Medical Sciences, PGI and AIIMS, and it's a once a week. We have a clinical case discussion with PGI Chandigarh and Delhi AIIMS and AIIMS Jodhpur. And we also have linked up with the Pali district, which is the adjoining district, with their district hospital for telemedicine and patient care for advice for patients. But we want to work more on this telemedicine, and sure in the next 4 or 5 years, we'll have more of these outreach facilities which we'll create. And Ayush is something which is which is Ayurveda, Unani, and homeopathy, which is also at AIIMS Jodhpur. They have a separate block, and we are trying to work on with the alternative forms of medicine, and trying to join with our modern medicine and see that how this integrative medicine works. And we run all these standard ICU services. It sounds that I'm saying that ICU service, but then all the big hospitals across the country can have quality services which are there. But then these were things which were lacking: a neonatal ICU, well-defined, following protocols, trying to practice evidence-based medicine. And so these are things which we have started here and there. And this is in 2015. We did a conjoint twin separation, which was successfully done, and there were, I think, 4-week-old neonates, and this was done. It was a good team of all the team was involved in doing that. So this just speaks about the infrastructure, facilities, and the expertise which is available in the institution, and the quality of care that the institute can provide. And this is definitely making an impact on the people here. And if the pathology, there was no such thing as an immunohistochemistry or a frozen section in this part done before. And this is something which is considered standard of care if you're treating cancer or anything. But then, as an institution, we initiated the services here as the first time in this part. So we get a lot of referrals from outside for our pathology also. And the Indian Council of Medical Research, we are establishing an advanced virology lab. They've given us a separate grant of around 14 crores to do that, which will have a further impact and help the services. And we, beside the routine biochemistry, a central molecular lab, we can boast of having the first 3 Tesla MR in the state of Rajasthan, a good DSA machine where they do interventional radiology with trained personnel available, a 256 slice CT, which was not there in this part. We have also run a dynamic interactive blood bank that if real time, you know what is available with us. So if anybody needs blood in the city, we never refuse that, all the blood components. So you can just go on our website, see what blood components are there, and there's a form available, a number, you just dial up and send the sample and we'll give you the blood. And nucleic acid testing and that IDNAT facility, which was not there. It's the only facility in the state of Rajasthan at a tertiary care level, which the institution provides. And things like cochlear implants, advanced minimal invasive surgery, which is quite common if you look at the big cities. It was not very popular here. And as I know, most of the surgery that the departments do, I think 60-70% of their surgical work is minimal invasive work, and they're doing all complex minimal invasive surgery. And we were also procured our first robot, which we got at the end of March. And since we have done around 82 surgery, and that's again something which was not there in Rajasthan as such, as the first public sector hospital to be having it. And we are sticking to doing complex surgeries, and a lot of the faculty here have come as mentors to when we were starting our program. And we see that, I'm sure that this is going to really develop further. And for cancer, we've got the advanced radiation equipment, which we don't have in other. So the transplant program is something else which is a big need in this. Jaipur has a good transplant program running in a few places. But then if you look at the public sector or tertiary care, it's not there. So we've applied for the license and we've undergone all the inspection, and we're hoping that by end of December, we should have all the paperwork done and looking at the beginning of next year or somewhere for the transplant. We've got trained personnel to do that. So that's something which is required in this part, and we are sure going to make some impact when we start off. It may be a small step, but yes, definitely it's going to touch the lives of the people, and the quality of life of the people would be definitely better. So if you look at the rapidly transformed healthcare sector and the public sector, with the HIS, the PAC systems, the electronic records, the mHealth services, and the telehealth and all the translational research facilities, and using of the technology and integrating it with your patient care is definitely going to make an impact. And these tertiary care public sector hospitals are the ones which will make an impact, because you're going out to the masses and treating a large sector of people. It's not that we're going to have solutions with these tertiary care hospitals for everything, but yes, it is definitely going to make an impact on things which are there. And we look forward to working on artificial intelligence, where the digital and the human aspects both are taken into consideration, and we see greater role of information technology, and we are ready to incorporate it and accept it in our working for betterment of the patient care or for teaching or for research purpose. And the healthcare system, if you look at it, because of all this, there is a rapidly transforming system, and if you look at it in terms of the market, it's going to be it's a major market in 2019. It's around $1.5 billion. That's what the healthcare market is expected to be in India. And if you look at the healthcare pillars by 2050, we could see that we'll have more of development on the neurosciences, artificial intelligence, gene manipulations, the robotic surgery. As we heard, Professor Bhandari yesterday gave a talk about the using of robotics for knee surgery, and more developments are going to be there. I think it's an exciting time, and these tertiary healthcare institutions, as they develop, they will definitely play a major role and will be able to provide quality healthcare and be part of this changing scenario in the country and will make a definite impact. And so, if you look at tertiary healthcare, we've always talked of a public sector boom. But if you look at the first 6 AIIMS which were created after Delhi, each had around 1,000 bed capacity. So this is what we call as a public sector boom in place of a private sector boom, with 6,000 new beds starting off at one given time. With new institutions coming in, there is definitely going to be requirement of people there. Everybody was passing out, wanting to go in to do quality work, was looking at the private sector. But yes, there is going to be a change. People would be looking back and joining public sector hospitals where they can deliver quality work and they can enjoy working and work with technology. And these institutions like AIIMS Jodhpur and the others, I'm sure, will be the cornerstones of affordable, reliable and quality tertiary healthcare and medical education in our country. And we hope to be there to be a part of this transformation. And what we believe in, that the future belongs to those who believe in the beauty of their dreams and work for it, just not dream, and that's what we've been trying to do. Thank you so much.